Urinary tract disease, also known as cystitis, is a term used to refer to an inflammation that originates in the bladder that can occur at any stage of life, not just in older adults as is believed. In most cases, this problem is usually caused by the invasion of microorganisms in the urinary tract, which is why it is called a urinary tract infection. Do you want to know how to cure the disease of urination, as well as prevent it on future occasions? In this video we will address the issue. This disease can have different origins and, therefore, knowing the cause of it is essential to treat it. If you notice that you have the following symptoms, you are most likely suffering from urinary tract infections. The symptoms of urinary tract infections may vary depending on the severity of the infection. However, the most common signs are low fever, chills, discomfort in the pelvic area, traces of blood in the urine, burning sensation while urinating, very frequent need to go to the bathroom, sensation of pressure in the lower abdomen, urinate in small amounts, back or side pain, thick, cloudy or abnormal color of the urine, nausea and vomiting. It is very important to see a doctor as soon as possible if these symptoms occur frequently. Especially if the old man's urine shows traces of blood or if he shows very strong pain in the lower back or laterally. Antibiotics are used to treat urinary tract infections and are sometimes used long-term in low doses to prevent recurrence of the infection. There are also many natural ways to protect against infection and reduce the risk of recurrence. Without further ado, here are the best home remedies to combat urinary tract infection. Blueberries. The antioxidant and anti-inflammatory substances contained in this fruit do the job of preventing bacteria from adhering to the walls of the urinary tract, so that you can eliminate them every time you urinate. It is recommended to drink 3 glasses of juice a day. Drink plenty of fluids. The state of hydration has been linked to the risk of urinary infection. This is because regular urination can help remove bacteria from the urinary tract to prevent infection. One study examined participants with long-term urinary catheters and found that low urine output was associated with an increased risk of developing urinary tract disease. To stay hydrated and meet your fluid needs, it is best to drink water throughout the day and whenever you are thirsty. Drinking plenty of fluids can decrease the risk of developing urinary tract disease by making you urinate more, which helps eliminate bacteria from the urinary tract. Bicarbonate of soda. Baking soda has alkaline, antacid and electrolytic properties, which contribute to the elimination of bacteria. To consume it, you must add 1/4 teaspoon of baking soda in half a glass of water, drink 2 glasses of water beforehand, and then the one containing the solution. Increases the intake of vitamin C. Some tests show that increasing your vitamin C intake can protect you from urinary tract infections. Vitamin C is believed to work by increasing the acidity of the urine, thus killing the bacteria that cause infection. A 2007 study of urinary tract infections in pregnant women looked at the effects of taking 100 milligrams of vitamin C every day. The study found that vitamin C has a protective effect, reducing the risk of urinary tract disease by more than half in those taking vitamin C compared to the control group. Another study analyzed behavioral factors that affected the risk of urinary tract infections and found that a high intake of vitamin C decreases the risk. Fruits and vegetables are especially rich in vitamin C and are a good way to increase your intake. Red peppers, oranges, grapefruits and kiwis contain the total recommended amount of vitamin C in a single serving. Increasing vitamin C intake can decrease the risk of urinary tract infections by making the urine more acidic, thus killing bacteria that cause infection. Take probiotics. Probiotics are beneficial microorganisms that are consumed with food or supplements. They can promote a healthy balance of bacteria in the intestines. Probiotics are available as a supplement or can be found in fermented foods such as kefir, kimchi, kombucha, and probiotic yogurt. The use of probiotics has been linked to benefits ranging from improved digestive health to improved immune function. Some studies also show that certain strains of probiotics may decrease the risk of urinary tract disease. One study found that lactobacillus, a common strain of probiotics, helps prevent urinary tract disease in adult women. Another study found that taking probiotics and antibiotics is more effective in preventing recurrent urine disease than using antibiotics alone. Antibiotics, the main line of defense against urinary tract disease, can cause disorders in the levels of intestinal bacteria. Probiotics can be effective in restoring the bacteria after treatment with antibiotics. Some studies have shown that probiotics can increase levels of good bacteria and reduce side effects associated with antibiotic use. Probiotics may help prevent urine disease when used alone or in combination with antibiotics. Practice these healthy habits. Maintain a correct hygiene of the genitals. It is of utmost importance that both before and after sexual relations, to urinate and wash properly, as well as, after cleaning up after the deposition, to avoid making contact between the urinary tract and the bacteria coming from the digestive tract. On the other hand, women should use pH-neutral soaps, in order to avoid altering the vaginal flora. Avoid using deodorants in the genital area and change towels or tampons regularly. The prevention of urinary infections begins with the practice of some good bathing and hygiene habits. First of all, it is important that you do not retain your urine for a long time. This can cause a buildup of bacteria, resulting in infection. Urinating after sex can also reduce the risk of urinary disease by preventing bacteria from spreading. In addition, those who are more prone to urinary tract infections should not use spermicide, as it is associated with an increased likelihood of suffering from urinary tract infections. Use the right underwear. There are fabrics that can cause allergy and itchiness, therefore, it is best to use cotton underwear or very soft fabrics with a high degree of breathability. Also avoid wearing them too tightly. Finally, when using the bathroom, make sure you wipe from front to back. Wiping from back to front causes bacteria to disperse into the urinary tract and is associated with an increased risk of developing urinary tract disease.